As Dr. Hamza Rafiq said, the most effective way to control the spread of disease and ensure that people enjoy better quality of life is to understand the source of the problem. That is the reason why the Caribbean Epidemiology Centre, CAREC, works hand in hand with all countries of the Caribbean in the surveillance, prevention and control of communicable diseases and in the development of health promotion programs. The Caribbean Epidemiology Centre, CAREC, works directly with all 21 member countries of the Caribbean region to improve the health condition of their people by advancing the capability in epidemiology, laboratory technology and related public health disciplines through technical cooperation, service, training, research and a knowledgeable and motivated staff.
The program and CAREC in general has been leaders not only in the Caribbean as it pertains to public health, but I think worldwide, because we have been very fortunate that quite a few of the initiatives that have been done worldwide as it pertains to eradication and elimination of diseases, that these started at CAREC, and as it pertains where most of the strategies were implemented for the population of the Caribbean community, and these have been successful, so the strategies have been extended to other countries and to the rest of the Americas.
CAREC also provides laboratory reference, epidemiological and statistical analysis, including situational analysis and trend assessment for all 21 member countries in the Caribbean. During CAREC's early years, malaria, yellow fever, tuberculosis and measles were major preoccupations of the institution. Today, emerging and re-emerging diseases such as AIDS, dengue and the influenza H1N1 have reassured the importance of the services provided by CAREC to the Caribbean people.
The H1N1 brought a new thrust to us as far as epidemiology in the center. Even though we were prepared a long while ago for such a pandemic, it sort of brought together all the players within the sector, an intersectoral relationship within the Caribbean. And CAREC was one of the focal points. As far as the surveillance and lab activity, we also help the guidance as far as reporting, informing countries as to what is happening not only in the region, but globally.
The history of CAREC started more than a half-century ago with the creation of the Colonial Microbiological Research Institute in 1947. In 1953, the Rockefeller Foundation established the Trinidad Regional Virus Laboratory.
And so that was a major impact. The Rockefeller Foundation was putting laboratories at the mouth of the major rivers of the world, and they decided to put the laboratory here as collecting species from the valley of the Orinoco. So after that happened in the late 60s and the program came to an end, and Trinidad at that time had become independent, the Prime Minister of Trinidad, Dr. Eric Williams, he invited the Pan American Health Organization to make use of this laboratory for the benefit of the people of the Caribbean.
In October 1974, through a multilateral agreement signed by the governments of the Commonwealth Caribbean, the Pan American Health Organization became responsible for the structure and operation of what is known today as the Caribbean Epidemiology Centre, CAREC.
We have been trying to provide a vision for the center as a module for surveillance and public health for the member countries, the 21 member countries of the British and the English and Dutch Caribbean that we serve. And now that there is a proposal by the ministers of the region to amalgamate the different regional health institutions into a single Caribbean public health agency, PAHO has seen the need to actually strengthen CAREC and refocus it on its core functions so as to be able to strengthen it better towards the transition to CARFA. And so therefore we have been actually putting together a whole series of measures to increase the efficiency of our laboratories in support of surveillance and of the epidemiology capacity that we have here in CAREC towards now being able to better serve the countries in that respect. And we are satisfied that at least that kind of direction has been set.
CAREC continues to reappraise how best to mobilize and apply resources in fulfillment of its Caribbean Cooperation in Health mission, which entails improving the health of Caribbean people by working with member countries to implement health promotion and disease prevention based on epidemiology and laboratory support for surveillance purposes.